Having access to mental health care, having a willingness to seek help, having a general population who is willing to seek help for their mental health care, and reducing the availability and access to lethal means. If we can do those three, we can reduce the suicide rate in Oklahoma. So what does that look like? When we talk about access to mental health care, again, as we've stated, if you had heart disease and you had no access to a cardiologist, your survival rate would be lower. So making sure that every Oklahoman has access to mental health care. We know studies have shown that 1 out of 4 Americans will have a mental health condition at some point in their life. Unfortunately, only 2 out of 5 will ever seek treatment. And so we've got to change that. We've got to make individuals, we go and get moles looked at. We go and get health care, get treatment for all sorts of things. If your brain, if you know that you're not sleeping well, that you've been more anxious, your heart's been racing, or you've been depressed and lethargic for more than 2 weeks, go and talk to your doctor. There could be a medical reason behind that. Suicide is a very complex phenomena that there never is just one reason. We would like, human nature would love if we could just point to one thing, but it's a combination of health factors, historical factors, and your current life events, and psychological factors. And the exposure to past trauma, more and more research, there are stronger correlations in every new research study between exposure to adverse childhood events and increased risk for suicide. Trauma changes the way your brain functions and can affect your health overall. It's funny, we always talk about suicide separate as if it's this moral thing, and it's not. More and more research and brain research coming out of physiological, biological things that it's a health condition. So it's time for that stigma to go away. Your brain can get sick just like anything else, and your brain can get well. These days, we don't think any less of our friends that have diabetes for needing insulin. We should be just as comfortable if we've got a family member that needs to take antidepressants, that needs any type of medication, that should be on the same level.